Hi, I'm Dr. Mariam. So today's topic is valvular heart disease. What is valvular heart disease? Valvular heart disease, it is characterized by or a defect in one of the four valves controlling the direction of blood flow through the heart, mainly mitral, aortic, tricuspids and pulmonary valve. So the valvular heart disease, it occurs when the any of the heart valves which will not do not work the way they should. So normally how do heart valves work? So there are four heart valves: mitral, aortic, tricuspid and pulmonary valves. So these valves make sure that blood always flows in forward direction and there is no backward leakage. So if there is any defect in one of these four valves, there can be there can be a defect in the controlling the direction of blood flow through the heart structure. What causes VHD? So coming to the causes, a heart valve may have missing cusp, may be leaking at birth. So initially, in case of from birth itself, there can be missing cusps in the heart valve, have a missing cusp, or it can be maybe leaking at birth too. Heart valve tissue may degenerate with age. So as you age, there can be a degeneration happening in the heart valve tissue. This also causes VHD. Rheumatic fever, bacterial endocarditis, it is the inflammation of the inner lining of heart muscles and valves. Hypertension, heart attack, atherosclerosis, and other disorders such as carcinoid tumors, rheumatoid arthritis, syphilis, or systemic lupus erythematosus. And this condition is also called causes VHD. And a medication called methotrexate, it is used to treat migraine headache, and some diet drugs also. So because of these medications also, it can lead to VHD. And radiation therapy, it is mainly used to treat cancer. So a cancer patient, if undergoing a radiation therapy, then that can also lead to VHD to the patient. Pathogenesis, the manner of disease developments, how the VHD or valvular heart disease, manner of disease, how this disease is developed. Normally functioning valves ensure that blood flows with proper force in the proper direction at proper time. But in case of VHD, valves become too narrow and hardened, that is stenotic, to open fully, or unable to close completely, that is regurgitation. So this stenotic valve that is hardened to open fully forces the blood to back up in the adjacent heart chamber, and the regurgitated valve, which is unable to close completely, allows the blood to leak back into the chamber it previously existed. So to compensate for poor pumping action, the heart muscles enlarges and get thickens, and thereby it will lose its elasticity and efficiency. So this is how a valvular heart disease developed. Types of valve disease. First one is stenosis and regurgitation. So because of these two conditions, in the pathogenesis, as I have mentioned before, because of stenosis and regurgitation, it can lead to valvular heart disease. First one is stenosis. In case of stenosis, valve does not open all the way, not enough blood passes through. And regurgitation, valve does not close all the way, so blood leaks backwards. So here stenosis, because there is no opening in the valve, the enough blood will not be able to pass through. And in case of regurgitation, the valve does not close, so the blood will while the passing of blood, the blood may leak backwards too. So this is the stenosis and regurgitation. Valvular disease. So valvular disease categorized into two: valvular stenosis and valvular regurgitation. So in valvular stenosis, the valve opening narrows Because of that, the valve leaflets may become thickened that the valve cannot open freely and obstructs the normal blood flow. So it can be caused due to the congenital anomalies, rheumatic carditis, or degeneration of the heart valve tissue. So what is the effect of valvular stenosis? The chamber behind the stenotic valve is subjected to in greater stress. So because of this greater stress, it may generate more pressure to force the blood through the narrowed opening. So this can lead to heart failure and valvular heart disease. Coming to the valvular regurgitation, it is a leakage or backflow of the blood results from the incomplete closure of the valve due to scarring and retraction of the valve leaflets or weakening of supporting structures. It can be caused due to the congenital anomaly, rheumatic carditis, infective carditis, dilated cardiomyopathy, traumatic valve rupture, and degeneration. So what is the effect of valvular regurgitation? In case of regurgitation, it causes the blood to pump the same blood twice as the blood comes back to the chamber. Because as it is mentioned, because of the leakage, the blood will comes backwards and the blood will dilate to accommodate more blood. So eventually this can also leads to heart failure. So this is the valvular stenosis and valvular regurgitation. Coming to the valvular heart diseases types. So the main types are stenosis and regurgitation. So as we have mentioned, the 4 heart valves. So if any defect happening in any of these 4 heart valves, it can lead to valvular heart disease. So in these 4 heart valves, there can be stenosis of the valve and regurgitation of the valve. So based on that, it is divided into this following: mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, tricuspid stenosis and regurgitation, pulmonary stenosis and pulmonary regurgitation. So these are the valvular heart diseases. So we'll discuss about the mitral one. So mitral stenosis and regurgitation. Under stenosis, it is almost always rheumatic. So rheumatic causes are the main in case of mitral stenosis, and can be caused by heavy calcification of mitral valve congestion, can be congenital also, and clinical features: breathlessness, cough, chest pain, fatigue, edema, ascites. And then next, management: anticoagulant drugs to reduce risk of systemic embolism can be prescribed. Digoxin, beta blockers to control ventricular rate in atrial fibrillation also can be prescribed. Diuretics to control pulmonary congestion. So in surgical, if the condition is not able to manage through medication, surgically we can do mitral balloon, valvuloplasty, mitral valvotomy, valve replacement. Next is mitral regurgitation. So the etiology is rheumatic disease, mitral valve prolapse, damage to valve cusps or chordae, ischemia, and it can be caused by congenital anomalies, degenerative myxomatous changes, Marfan syndrome. So because these are the causes and etiology of mitral regurgitation. Coming to the clinical features: fatigue, weakness, cough, dyspnea, cardiomegaly, that is enlargement of heart, pulmonary hypertension, edema, ascites. So these are the clinical features we can see in an individual of mitral regurgitation cases. And management, we can prescribe vasodilators and diuretics, and surgically we can do mitral valve repair or replacement in case of mitral regurgitation. Next is aortic stenosis and regurgitation. Etiology. So this is divided into 3 parts. Coming to the aortic stenosis etiology: infants, children, adolescents have a congenital aortic stenosis because of subvalvular aortic stenosis, and young to adults to middle aged, calcification and fibrosis of congenitally bicuspid aortic valve or rheumatic aortic stenosis. Because of this, it can lead to aortic stenosis. And middle aged to elder, senile degenerative calcification of bicuspid valve or rheumatic aortic stenosis. Because of this also, it can lead to aortic stenosis. And coming to the clinical features: dyspnea, angina, syncope, sudden death, pulmonary edema, slow rising carotid pulse, pulmonary venous congestion. These can be seen in this condition. And about the management, moderate or severe cases, evaluate every 1 to 2 years, and with the Doppler echocardiography, and anticoagulants also advised in this case. And for surgically, we can do aortic balloon valvuloplasty, valve replacement also, and aortic regurgitation. So congenital and acquired, and under acquired it can be rheumatic because of the rheumatic disease, caused because of rheumatic disease, infective endocarditis, trauma, aortic dilatation. And symptoms, it is usually asymptomatic, but breathlessness, angina, awareness of heartbeat, it can be seen in case of aortic regurgitation. And management, the vasodilators such as nifedipine or ACE inhibitors can be prescribed in this case, and the annual follow-up should be done in this condition. Surgically, we can do valve replacement or repair in case of aortic regurgitation. Tricuspid stenosis and regurgitation. So under tricuspid stenosis, it is mainly due to rheumatic heart disease and increased systemic pressure. Because of this, it can lead to tricuspid stenosis, and symptoms can be hepatomegaly, that is the enlargement of liver, ascites, peripheral edema, neck vein engorgement, and hypotension. It is hypotension, not hypertension, in case of tricuspid stenosis. And surgically, there can be valve replacement, valvotomy, balloon valvuloplasty can be done. Tricuspid regurgitation. What are the causes? Rheumatic heart disease, endocarditis, congenital anomaly, right ventricular infarction, pulmonary hypertension. These are the causes of tricuspid regurgitation. And symptoms: tiredness, edema, venous congestion. Management, diuretics and vasodilators can be prescribed in case. And surgical management is valve repair and replacement. So majority of the time, till now we are seeing only valve repair or replacement are the major surgical management in the case of valvular heart disease. The last one is pulmonary stenosis and pulmonary regurgitation. So pulmonary stenosis, the symptoms are fatigue, dyspnea on exertion, cyanosis, poor weight gain, hepatomegaly, ascites, and edema. Surgical management, percutaneous pulmonary balloon valvuloplasty can be done to manage surgically the pulmonary stenosis. And coming to the pulmonary regurgitation, it is a rare condition associated with pulmonary hypertension. The blood flows back into right ventricle, so the right ventricle atrium hypertrophy will be seen or developed, and symptoms of right-sided heart failure can be seen in this case of pulmonary regurgitation. Next, diagnosis. So how we can diagnose valvular heart disease? ECG to measure electrical activity of heart, regularity of heartbeats can be done, and chest x-ray can be done to diagnose the VHD case, and cardiogram to evaluate heart functions, and cardiac heart catheterization. So this is done like it is like the threading of catheter to the heart chamber to measure pressure irregularities across the heart valves. So mainly to detect stenosis, and to observe backflow of an injected dye on an x-ray. So it is also used to detect regurgitation. So basically to detect the stenosis and regurgitation condition, this cardiac heart catheterization is done. And one more